To perform a bridge, assume a supine position on a stable surface with both knees flexed at a 60-degree angle and feet positioned flat on the ground. Feet should be hip-width apart and close enough to the body that feet can comfortably lay flat on the ground. The head, shoulders, and scapulae and neck should also be relaxed and not engaged in the exercise. The arms can be positioned on each side of the body or cross over the chest. Once assuming the proper starting form, elevate the hips through the sagittal plane by simultaneously contracting the gluteus muscles, contracting the hamstrings, the abdominal and posterior spinal muscles to maintain the proper form and stabilization throughout the motion. The hips should be elevated to full extension, which would be approximately 0 degrees, where knees, hips, and shoulders will be aligned. Maintain the alignment for a moment, then slowly lower the hips back to the starting position. Throughout the exercise, the force of motion should always come through the hips, and not from heels, arms, or spine muscles. Hips lifted before the back to avoid overarching, and maintaining posterior pelvic tilt will allow for the abdominal muscles to stay engaged and help keep the spine straight.
A common mistake made when completing the bridge is overarching the back. This results in the forces of the motion to be translated to the spine and neck. The angle of the back will be less than the goal of 180 degrees, and the angle of the knees in regards to the hips will exceed 90 degrees. This mistake can result in injury to the actor spinae muscles through the overextension of the back.
Another common mistake is incorrect foot position. If the feet are too far, this results in the heels not being able to stay flat on the ground. Also, the inadequate angle of the knees does not allow for full contraction of the gluteus muscles. This can result in activation of the spinal or hamstring muscles, which is counterproductive to the correct motion of the exercise. In addition, if the feet are too close, the angle of the knees relative to the hips will be too small. This results in the knees passing through the straight plane of the ankles. This could result in activation of the hamstrings in particular, which is not ideal for the bridge.
Another common mistake with the bridge is adopting valgus knee position. This is when the knees break the straight plane with the ankles and floor. The valgus knee position compromises the stability of the soft tissue in the knee joints and can cause injury.